With that, just a moment. Okay, we have begun recording now. All right, so we are going to jump in and okay, I was checking to make sure. Um, I am going to send out a document here in just a moment. Welcome to the first portion of Benefits 24/7 training. Thank you all for coming today. Um, I want to start. I know it's kind of silly. We're going to start at the login page here and just kind of give a brief explanation of the two different login buttons because you guys will be getting phone calls from our subscribers to understand. I'm sure people are going to call and have some confusion. So we really have the two login options here. The top, as you can see, employee, subscriber. This is where our actual retirees and continuation coverage members, they will use this option here to log in to Benefits 24/7 to complete submitting their requests and other various actions, open enrollment, things like that. Also, because you guys are all HCA employees yourself and you have PEB benefits available to you, when you go in to manage your own benefits during open enrollment, go in and add dependents, make changes, those kinds of things, you will also use this top login button. And you will have to use, you'll log in through SAW, Secure Access Washington. So really wanted to make a distinction here. This top login button is for our subscribers or employees. And then this bottom login button is what we're going to use as HCA staff members when we're actually helping manage benefits for other folks. So the bottom option is what we'll use as HCA staff to complete our work. So with that, I'm going to go ahead and jump in and we'll start looking at how this system works. So the purpose of this training between this week and next week is we're really going to be looking at an overview of the functionality of Benefits 24/7 and solely focused with this group on the retirees and continuation coverage and how Benefits 24/7 works for that. We are going to have additional opportunities to ask questions and even looking at sometime in April. I don't have a date or time set up yet, but having additional time in April where people kind of like a drop-in session where folks can come in and ask additional questions. And like I said, we don't have anything set up yet. And really that will be up to the discretion of supervisors and managers on how to manage that. But we do recognize that as this training is focused on the functionality of Benefits 24/7, there will continue to be questions after this week and next week. So providing that opportunity for folks to bring questions to us. So throughout this training, feel free to just take yourself off mute and ask a question if you have a question in that moment. You can also use the chat feature. I have friends with me to help answer questions. Um, Jeff Grobner is our resident self-pay expert. And I also have Jessica Pratt McConnell. She is our project manager and she's taking notes today. So if there are things that maybe we're unable to answer or things that we need to take back to our project team and review, she'll be capturing those as well. So before I dive in, any questions, comments, anything up front that anybody wants to ask or comment on? You all can hear me, right?
When is this supposed to go live?
Okay. Um, so the launch date right now is May 8th. So that's the date. It is a Monday, and that's when this will be turned on for everybody to use.
Thank you.
Right? Yeah, no problem. Okay, I'm going to go ahead and log in as an HCA user here. And because I am in the training environment and connected to VPN, it's just asking me to select my Active Directory user here. Okay. So this is what Benefits 24/7 looks like on the dashboard when you first log in as a HCA staff member. And I'm going to do a brief overview of what all of these things mean, and then we'll really jump into the self-pay retiree continuation coverage section. So this is our dashboard, and every time you log in, this is what you'll see. There's several different pages within Benefits 24/7. We have managed subscribers, and managed subscribers is an opportunity to come in and look up anybody that's in Benefits 24/7. This is any active PEB member, any active SEB member. This is retirees. This is PEB continuation coverage, SEB continuation coverage. So anybody under those umbrellas who has PEB or SEB benefits, you could search them and manage subscribers. So this is beneficial when you're getting a phone call from a member who is looking to retire. And if you want to search them in the system, you would come to this manage subscribers. You can search by first name, last four of a social, or a full social, recognizing that the search feature does not allow for combining. So I couldn't type this and get a result. But if I was to type, and I don't think there is Amanda's in here. So first name, it will search upon that. We just can't combine first and last or last and social. Um, so first, last four of a social or a full social, and you'll be able to get results. So this is where we would search for any and all members in PEB and SEB. And then up here in this purple, now our training environment, which you guys do all have access to, the training environment does have a different color scheme than what will be our final color scheme. So I'm going to reference the purple navigation bar up here, but once we go live, it should be, I believe it's blue. So I'm going to select the admin dashboard here in the navigation bar, and this is just going to take me back to my dashboard. So any of these, we consider these tiles or widgets, whatever makes the most sense to you. They also do map to a link in the navigation bar at the top of the screen. So I referenced the manage subscribers. I could either click on this tile here on the dashboard, or I could click on the subscribers in the navigation bar, and it will take me to the same place. So heading back to my dashboard here, manage access. This one shouldn't be super relevant to your guys' everyday work. This is managing access for benefits administrators, folks who manage benefits for PEB and SEB organizations. And so it's giving people the ability to go in, and let's say I was a benefits administrator for Department of Corrections. That's how I would get access to go in and add employees into Department of Corrections to be able to, manage my employee benefits. So I'm not going to touch on that one today, but recognizing that we are going to just touch base on each of these sections. Manage organizations. This is actually where we could get to every single organization that has PEB and SEB benefits. So the list is quite extensive because there's a lot. In SEB alone, we have 310 organizations, and in PEB, there's many, many, many more than that. So if you needed to get to a specific organization, you could come in here. If you had all the time in the world, you could just go page by page, or for much easier access, you can search. There's many different ways that you can search. And as you can see here in gray type font, it does tell you how you can search. So you can search by an organization name, HCA agency number, or an organization type. We also have filter options at the top of the screen here. So if you were looking to only search within the PEB organizations, you can select this button here and then search for um, thinking. So if we search for Asotin, we would come up with all of the applicable PEB organizations with that name. And if I was to unselect the PEB button and hit search again, we do have an additional option that comes up that was a SEB organization. So just recognizing that we have additional filters to be able to search within PEB or SEB only. So I am going to go back to my dashboard. We have a dependent verification section. This is really applicable for our active PEB and SEB employees, and this is even more specific to extended and disabled dependents. And so I'm going to hold off on reviewing that until we get deeper into the self-pay portion of this of benefits 24/7. There's also special enrollment event verification. Again, we're going to touch base on that here in just a few on our self-pay dashboard. There is a reports section. If we, there's a lot of different reports, and most of this is applicable to our PEB and SEB active employee organizations, being able to see dual enrollments, for example, or benefit election status, spousal reattestations, things of that nature. So there's a lot of different manners in which we can run reports and see various information throughout benefits 24/7. Head back to my dashboard here. We have application settings. This is really a place where mainly ETS staff, someone like myself or other folks, would be coming in to manage our open enrollment dates, potential messaging that we need to put on benefits 24/7. So most of us will not be using application settings. And the same with error handling. So one of the things that's different as we move into using benefits 24/7 than how our current practices are. Currently, when we're getting enrollment forms or change forms from our retirees or continuation coverage members, we're reviewing those, we get them through imaging, and then we're going into pay one and we're keying on the various screens, and that's how we do our workload. Well, in benefits 24/7, since all of that work is being done directly in benefits 24/7, we still do have to get the information over to pay one, because pay one does do all of the invoicing and billing for those folks to receive those benefits. And so in order for us to get the information from benefits 24/7 into pay one, we have a process where every night we send over any new people, any changes, or any terminations to coverage, and we send that information over to pay one so that pay one can appropriately invoice for those things. And so this error handling page, again, is mostly for ETS staff to see if there was any issues with that information flowing from benefits 24/7 to pay one. So this again is more for ETS folks, but I did want to recognize and acknowledge that because of this change in process and keying all of the new enrollments and changes and terminations into benefits 24/7, I did want to take a brief moment to talk about how that information does still need to go to pay one. And when I talked about the information still going into pay one, to do invoicing, you probably noticed I didn't say that Pay One sends the information to carriers. And that is because Benefits 24/7 is actually the one communicating directly to the carriers. And so that is a change from current practice. And so it's very important to recognize as we do move into using benefits 24/7, because benefits 24/7 will be the ones sending all of the information to the carriers now. So it is a big change, but I did want to acknowledge that up front. The other really cool thing that we have created here in Benefits 24/7 is a subscriber enrollment history. And we will touch base on this throughout the training. I'm not going to dive in right this minute because I would actually like to walk through some enrollments and processing requests before we look at the enrollment history. But it does give us an opportunity to see what has been done on a subscriber account, who has made changes, when changes were made, etc. So before I move off of this page, is there any questions? Okay, quiet group so far. I'm going to go ahead in the chat. I'm going to send out a link to the user manual that was created prior. This user manual, I'm sure, will be further developed by, I'm guessing, Alexi's team. In the training capacity, but it does give a high level view into how to do the different functions and benefits 24/7. So I wanted to make sure that folks had that in addition to any other materials that you guys will get along the way. So I'm going to go ahead and send that. All right. So now we're going to go into the area in the application that you guys will be using the most. And that is this self-pay dashboard. So again, we can get there from this tile down here or up in the navigation bar if we click on self-pay dashboard. And here you'll see it looks very similar to that main dashboard when we log in to Benefits 24/7, but there's less options. So really this is focusing on managing subscribers that are only in retiree or continuation coverage, dependent verifications that are applicable to retirees and continuation coverage members. Same for special enrollment event verifications, and then, of course, where the bulk of our work will be is in this continuation coverage and retiree request queue. And then we do have access to the reports. So what I would like to do is actually start by showing you guys what it looks like from a subscriber. So a member who is going to submit a retiree request. So I would like to show you guys what that process looks like. So I'm going to sneak back into my HCA dashboard because I'm going to come in and show you what it looks like from the subscriber perspective. So let me pull up my subscriber here. And this managed subscribers where I have searched for somebody is very, very similar to the self-pay managed subscribers section. So everything that I walk through here as far as searching and how to actually get into their portion of the system is very much the same. And we will look at that here in just a moment through the self-pay section. But I just want to recognize when we search for a subscriber, you see that my result comes up down below in this grid, and there's a checkbox to the left of the, I had to pause because I wasn't, I had to think if that was left or right, to the left of the first name. And so if we select the checkbox, we have a new button that populates that says Manage Associated Subscriber. And that's how we actually get into their portion of benefits 24/7. So I'm going to select Manage Associated Subscriber. And how this looks right here is this dashboard. You can see it says Subscriber Dashboard. And this is my person, customer service. And so if I was actually to log in benefits 24/7 as customer service, this is exactly what I would see on my dashboard, minus this newly eligible thing here. This I only see because I am HCA staff right now. But these sections on my dashboard are exactly what I would see if I was logged in as the subscriber. So what we could do as a active employee, you guys are all very familiar. I can go in and submit a retiree request at any time. I can submit it for, let's just say July 1st or something like that. So I can come in and go to my retiree and continuation coverage tile here. I'm going to select that. And it's going to take me to this page, and it gives me some information about retiree coverage. It gives me a link to go to the website to learn more about retiree coverage. And then it gives me the opportunity now to start a request. So in this drop down, because I am an active PEB employee at this point in time, it gives me an option to submit a retiree enrollment or deferral form. So I'm going to select that option and I'm going to create a request. So this question, would you like to opt out of completing the retiree enrollment deferral form? This question will only be visible for us as HCA staff. If I was logged in as customer service, as the subscriber, I would not see this question. It would take me directly into the form. But we do show you guys this question because, oh, Stacy just put in unable to see drop down options. I sincerely apologize about that. Uh, I do not know why that happens, and we've been unable to figure out why drop downs are not showing when I present in Teams. So I will make sure anytime I select a drop down that I read through all of the options. So I'm sorry about that.
It is important to note that they are working and Amanda can see them.
Yes, thank you. Okay, so this question populates for us as HCA staff because we recognize that paper forms are not going away. And people will still have the opportunity to submit a paper request for their retiree or continuation coverage. And so this question allows us to just submit a request to start the process, which we're going to walk through. But in this case, I'm actually going to not opt out of the form because I want to show you guys what the form looks like. But if you were to receive a paper form through imaging, through your normal workload of how things are going now, when you came in and you searched for a subscriber and you started a retiree or continuation coverage request because you have a paper form, you could say, yes, you want to opt out of doing the form. You already have all the information you need, and it will just submit the request and then you'll move to the next step of your process. So for right now, we're going to go ahead and say no, and it's going to take us into now what the subscriber sees in submitting a retiree request. So here, again, it's just some information about retiring and submitting requests. So I'm going to go ahead and select proceed to payment information. And this is going to look and feel very familiar. It's very much like the actual paper forms that they're already using, just kind of in a more electronic version. It's going to walk them through the process a little bit. So we can select our payment option here, pension, electronic debit, monthly invoice, or here is where they would have the opportunity to select defer enrollment in retiree coverage. So for purposes of this, I'm just going to go ahead and select monthly invoice and proceed to the form. So because my subscriber is already in the system and I'm acting as the subscriber right now, a lot of our demographic information is already going to be populated. So we already see their social, date of birth, first and last name. We do have the address that's already been in the system populated, but if my address changed, I could update it at this point in time. I could also add a mailing address if I needed, or I can select the checkbox that my mailing address is the same as my residential, and then that section goes away. Then we move into the actions. If we're going to enroll, defer, enroll after deferring, or separating from service. So I'm just going to go ahead and say enroll in this case. We're just going to do kind of a happy path, a pretty basic enrollment here. And I'm going to put in my retirement date. And I think for purposes of today, we'll just go with July 1 because I know that's a pretty popular retirement date. And then requested coverage effective date. Again, we'll go ahead and say July 1st here. We have the ability to select the retirement plan that I'm in. So we'll go ahead and say in this case, a PERS 2. We ask about Medicare information. I'm going to go ahead and say no, but if I was to say yes, it is going to require me to put in the effective date on for my Medicare Part A and Part B. Actually, how old is my person? Okay, go ahead and say no for this purpose. Enrolled in Medicare Part D? No. Enrolled in Medicaid with Medicare Part D? I'm going to say no. We have our Medicare number field here. So they would put that in if they had selected yes for Medicare A and B. And then we move into the enrollment section. So what benefits would we like to enroll in? Medical, medical and dental, retiree term life insurance. So I'm going to go ahead and select medical and dental for today. We also have the option for deferring and the deferral date, or the option for enrolling after deferring and the date that our other coverage had ended. And then the checkbox that we would select if we were deferring or enrolling after deferring. And again, this should look very familiar, very similar to the paper form currently. We have the retiree term life insurance section. So if they chose that they wanted to enroll in that term life insurance, we provide them some information, link them to the enrollment form, and ask them to acknowledge that they will upload that form into Benefits 24/7. And then we also have the tobacco surcharge question. So if the subscriber was enrolled in Medicare Part A and B, this option would automatically be selected because we know the surcharge does not apply. In this case, since I'm not enrolled in Medicare yet, I do need to answer the question. So I'm going to go ahead and select that no, I do not use tobacco products. And now I can proceed to my dependent section of the form. So here, if we have any dependents already on the account, they will display under current dependents, just like here I have a spouse listed. However, if they needed to add any new dependents onto their account, they simply just select the add dependent option. We have a new section here that has populated in the current dependents. We select that new option, we expand this section, And it's going to walk us through submitting, adding another dependent to the account. What their relation is, social security number, birthday, first and last, if they're enrolled in Medicare, etc. All of the same questions that we are familiar with answering. So I'm going to actually just go ahead and hit cancel on this because I want to walk through our current dependent who's already on the account. So if I want to add this dependent to my retiree coverage, I would need to expand that dependent's record. Again, we already have some pre-populated information based on them already being on my account for PEB active employee coverage. Again, answering the Medicare information here, I'm going to go ahead and say no for Part A and Part B. Not enrolled in Medicare Part D. Do not have Medicaid. And then here I select what coverages to enroll this dependent in. Dental is automatically selected because the subscriber said that they were enrolling in dental, but I'm also going to select medical for my spouse. And then I need to answer the tobacco surcharge, so I'm going to say no. And then the spousal surcharge question as well. I'm going to say no, and I do not have employee coverage available to me, which is question 2. So I'm going to go ahead and select that checkbox. And now I am going to select Save Changes. At this point in time, if I have no other dependents to review or add to my coverage request, I'm going to go ahead and hit Continue. And here I come into the option to select my medical plan. So we have all of the plans available, again, because we are HCA. We see, well, I'm sorry, because this is a form, we do have all of the plans available. I know we do have a request in to only show plans available based on where the individual lives. And so we are working towards that. And there will be that functionality in the future. I'm not entirely, I can't remember off the top of my head where we have that placed, if it's going to be before we go live or not. But we do have that request to only show available plans based on where the individual lives. So for this case, I'm going to go ahead and just select that we want to have UMP select for my subscriber and spouse. So I can select that plan and continue. I can select my dental coverage. If I select Delta Care, I like to point out this message. We know that there's been a lot of confusion with Delta Care because of Delta Dental. So if that plan is selected, they get an additional message that populates on the screen. I'm going to go ahead and change back to uniform and continue. Here is where we would upload any applicable documents. So if we need to upload dependent verification, we could do that here. If we need to upload various other forms, if we're enrolling in a Medicare Advantage plan, we would, I think that's a separate form. This is where I'm not 100% certain on all of the forms that our retirees have to submit. But any forms that they would need to fill out in addition to the basic retiree request, they would fill them out and then upload them here. So as simple as using this box to select a file, and a file folder will open on their desktop, and I'm just going to select something here so you guys can see what that looks like. So now you can see that I have uploaded a file, and down below it will ask me what kind of document are you uploading, and there's all of the options, right? Because there's so many different things that we could be uploading, such as if it's dependent verification, we need to have all of those applicable documents. We also have in here termination letters, if we had lost coverage, which might be applicable for COBRA or unpaid leave. We have Medicare forms. So basically all of the applicable documents are in this list. You guys cannot see, I recognize that. It is a very long list with all of the applicable documents that could be used and uploaded in Benefits 24/7 to enroll in coverage. So I'm going to go ahead and select tax return here. Let's say we're using this to verify our dependent. So I'm going to go ahead and select upload, submit changes. And now my document has officially been uploaded to my request. So I'm going to go ahead and hit continue here. And now, before I submit the request, it gives me, first of all of our legalese here. It also gives me the opportunity to download a copy of my form. And so this is, an opportunity for our retiree or continuation coverage member to really keep a copy of that request that they have sent in. So it's as simple as selecting the button to download, and it will then download to the computer that they're using. So if we open that document, here is a PDF version of the request that they now are going to be submitting. So all of the things that we just walked through, and this is important because this is essentially what you guys will be seeing when we go into process a request. So this is what the request form looks like. So I'm going to go back to my request here, and now I'm going to go ahead and hit submit. So now that we have hit submit, we see that the status is in waiting for review. So now my retiree request has been submitted. At this point in time, if I was to come in and select the checkbox, I can come in and I can re-download the request. I can edit the retiree request up and until the request has been approved. So because this is in waiting for review, I can still go in and make edits to that request form. I can also delete it. Let's say I made a mistake and I don't want to edit. Maybe I submitted it too early, or maybe July 1st isn't the date that I wanted to retire. I could come in and delete that request. And I think that is the bulk of what I wanted to go through in submitting a retiree request. So does anybody, I'm going to keep asking if anybody has any questions up to this point. Right?
I got a quick question. How quick would this be available to view? Like once they submit it, is it then instantly viewable? Like could they call us and then say, "Hey, I submitted this. Can you check and see if it went through?" Because we get a lot of calls like that. Is that something that we could then verify pretty quickly?
That is a great question. Do you go by Brad or Bradley?
Either one's fine. Brad,
Okay.
I guess.
All right, Brad, let's go look. So I'm going to head to my self-pay dashboard because this is where you guys will be spending the bulk of your time. So earlier, I don't know if you guys saw this or not, but on the continuation retiree request tile here, it did say you have 4 pending requests. Now I just submitted one for our customer service. So now this says 5. So I'm going to select this request queue. And first and foremost, when we come into this request queue, this is defaulted to show only items that are assigned to me. Now, we worked with Jody quite a bit on understanding work assignments and how that happens. And so when any one of us comes into this request queue, initially it's going to show if there are items assigned to you. So right now I have somebody that's assigned to me. I'm going to go ahead though, and I'm going to unselect this checkbox, show items assigned to me. Now this is going to show all of the pending requests, regardless of who they're assigned to or not. So you can see, Brad, based on your question, here is our customer service retiree request that was submitted. We can already see it right away. As soon as they submit it, we can see it here in the request queue. So if we want to go ahead and work on processing this request, we would select the plus sign here, which is the expanding the request. And now it's going to give us information on the subscriber themselves. So their name, social, date of birth, and their account status. So their eligibility, they are in active, which means they're still enrolled as a PEB employee. They do not have a loss of eligibility date or eligibility reason because they're still employed, and they're employed with Department of Veterans Affairs. And they have full benefits. So here we can see coverage end dates. And again, because customer service submitted their retiree request for July, they don't have any end dates for their coverage. But I wanted to look at this because I do know that when we receive these requests in our work queue, we have the ability to then put them into pen status, right? Pen for the various months. So we would come into this request and we would look at this processing status. It's going to continue to be in pending, but then we could put it in penned for July. If we do that, we can hit submit changes and then we can move forward. We can also, when we're processing or when we're actually reviewing a request, this is how, so this little picture right here looks like a mountain with a sun. This is how we're going to select that request to download the form. This is the same form that we just looked at for our customer service a moment ago when they submitted their request. And this is the form that we will use to then process the request to put them into the coverage that they have requested. So we could, of course, I'm only sharing my Chrome right now, but however you guys would manage that if you do a side by side, but this is your form that you will then use to process the request. So I'm going to go ahead and change this here. Let's go ahead and say that this is approved and it's pending payment. So we looked at this request, it looks good to go, and we want to go ahead and approve it, but we haven't got payment. Once we select that request status for pending first payment, we're going to have a process date. It's automatically going to apply to today's date. And then the processing status, of course, penned for first payment. At this point in time, we'd want to go ahead and submit changes. And once we've done that, we see this message here that says, to enroll or make changes to enrollment, this account must be updated to an active self-pay eligibility type. Please use the Add Self-Pay Subscriber functionality to update the self-pay eligibility information. Once you have entered that, you can return to the request to process the enrollment changes. And you can see here that you cannot process enrollment changes yet because they don't have a self-pay origin record, meaning they are still an active employee, or maybe they have been terminated, but they haven't actually been added to eligibility for their retiree coverage. So how can we then go and update that? So we can select, if you see as I'm hovering over Add Self-Pay Subscriber, that is a link that will take you directly to adding a self-pay subscriber. But in this case, I know that my person is still enrolled in employee coverage. So we would need to do our due diligence, right, of And of course I used a July date, so I know that that's in the future, but wanted to show you all of the options here with status and requests, things like that. So in the case where somebody had submitted a request and they're not yet terminated, then we go through our normal working process to handle that. But what I'm going to do is actually, I'm going to go ahead and terminate my person really quick. Say I'm the benefits administrator for Department of Veterans Affairs, and I'm going to go ahead and terminate my person. And we're going to terminate them at the end of February. Okay, so now I go back to my I am moving through this portion pretty quick because I know that this is not a part of our actual tasks. So now that customer service has been terminated, here's what we're going to do. We're going to go to the manage subscribers. Over here, you can see this button that says add self-pay subscriber. We're going to select add self-pay subscriber. And here's where we will put in that social security number and then their agency effective date. So let's say 3/1/2023. So I know I submitted the request for July 1st, but let's try, we're going to add them for March 1st. This is not a normal course of action, but I want to walk through the process of adding their self-pay record here. So here's their social security number and their agency effective date, and we're going to select next. Here it tells us we do have a subscriber that we have found, and it tells you their first and last name and their social. And you want to go ahead and select claim. And here's where it's going to look very similar to not similar to the 41 screen, but this is where we would input that same information. So here we already have the first and last name, social, date of birth pre-populated. We have additional information. If we had phone numbers, those would be populated here. And then we move into their eligibility information. So based on what we have submitted from the retiree via their request, we would go ahead and start updating their eligibility information. What option would I select? Jeff beat me to it. 107A. Perfect. All right. So we're going to select their home agency, sub-agency, eligibility type. This is a retiree. So we're only showing the applicable eligibility type based on what home agency, sub-agency is selected. We then have eligibility reason. There's 4 options here. We have 01, 12, 04, and 05. So we're going to select 01, which is newly eligible. And then in the original agency, sub-agency, this is where we would select their PEB organization or sub organization that they worked for. Of course, I selected one and I don't remember what DVA is. So I'm just going to make it up and select something. So don't judge me if I picked something wrong. Pay method here, we have only the applicable options will show. So automatic bank account withdrawal, personal check, pension deduction, or if they're deferring enrollment in retiree coverage, we would select that. On this request, I know the person selected personal check or money order, so that is the option that I'm going to select in my pay method. If we were adding a person to COBRA, we would then be able to select the COBRA qualify reason. We'd input that COBRA self-pay end date and the election period end date. But because this is a retiree, we do not need to complete those fields. We complete our originating SSN here. We have an agency effective start date that is pre-populated from what we put on the initial ad first page where we entered that social security number and start date. And then we're going to go ahead and put in that retirement date. If we had received Medicare information from the retiree on their form, which would be here in this Medicare section, we would submit that into the Medicare information, but because this person is not enrolled, we can go ahead and move past that. And then we see their address is already pre-populated. We do not have an additional mailing address, so we can go ahead and select that checkbox that it's the same. If they did submit a change to their address on the form, we can go ahead and update that at this time. And then once we're done, we go ahead and hit submit. And then you'll see that the screen comes back to your managed subscribers page and you're like, I don't see anything. You get a little notification at the bottom of the screen that it was successful. Your subscriber was successfully added. So just to show you, if I search for customer here, you can actually see that they come up in my search. And over here in employer name, you see that they're now it says self-pay organization. So now that I have added my self-pay origin record, I'm going to go back to my self-pay dashboard here. And then I'm going to select back onto my retiree request tile. I'm going to unselect show items assigned to me. And at this point, I'm also going to unselect show only pending request. And that's because we already approved the request that came in from customer service. We did that. We knew that it was good to go, and then we needed to add their self-pay origin record. So once we've done that and we come back, we're going to expand their request again. And previously we saw that message that said you needed to add their self-pay origin record in order to proceed, and this process enrollment changes button was not selectable. Now you can see, you can now make the allowable changes to this account. Please click the button below to begin the process. So now we're going to go ahead and select process enrollment changes. And then we can come in here and select what is our coverage effective date. So based on adding them as eligible, we know that their coverage effective date is going to be March 1st. We're going to go ahead and select next. So this is really, don't do this to me. That's not going to happen. Okay, I don't know why it did that. So once I selected that process enrollment changes, this is really what you guys will be doing the majority of the time when you're getting these requests. After we've added that self-pay origin record, we come back in and now we're actually completing the enrollment portion. This would be like going in and keying onto the 44 screen, the 45 screen, the 46 screen. This is essentially what will be now processing that enrollment. So referring to our document, the request document that the subscriber submitted, I'm going to go ahead and look. Must be on the first page. Plan selected. Here we go. It's right at the top of the second page. So they selected, and I recognize this is kind of small, so let me zoom in here. So they selected their medical plan as UMP Select. So I'm going to come back to my request here. And current medical plan for coverage effective date of March 1st. I'm going to go ahead and select UMP Select. That is what the subscriber requested. Wanting to point out that it does have the additional options based on what the retiree has submitted on their request form, that we can defer that medical coverage if that's what they've selected. If they are deferring due to Medicaid, we can select that option as well. And we also have the option to select retiree term life here on this page. So if they had selected to enroll in that coverage, we would select this checkbox. We also have, as HCA staff, sometimes we know there are allowances for folks to enroll in plans that aren't necessarily available to them based on where they live. Sometimes there's just an exception to that rule. And so if we need to see all of the medical plans that are available, we have this checkbox up here to see all plans. If we select that, you'll see, like, here's a perfect example. The Kaiser Northwest Senior Advantage Plan populates. And this person wouldn't necessarily have that available to them. But if for some reason we needed to view all of the plans that were available, we can select that checkbox and see all of the plans. Trying to remember to show all of the little things on each of these pages as we work through them. So I'm going to select the UMP Select, which is what the subscriber wanted, and hit Next here. Now it takes us to the dental plan, and you're going to notice that for dental, it automatically has populated what the subscriber selected on their request form. So uniform dental plan, it's already selected for us. We just need to confirm. And there is a reason why that is not necessarily the case for medical, and that really is based on split accounts where we have one member who's on retiree coverage and one who's on non-Medicare coverage. So recognizing that sometimes we need to have two medical plans selected, so we do not pre-populate that medical plan, so you will need to make sure that you review the form and select the medical plan, but the dental is pre-selected based on the request that they have submitted. We also have, if they were to not continue dental coverage or they were removing dental coverage, we have that checkbox down here as well. We're going to go ahead and select Next. So here's where we would see the plan alerts. So this is more something we're used to seeing in the classic PEBMI account, or our SEB employees are used to seeing the various plan alerts based on a plan that they have selected. So we would see those here, and then we can review the information. So we have selected a medical plan, UMP Select, and the dental plan here. And now it's going to take us into the dependents. So if all of this looks good so far, we're going to go ahead and select Confirm and Manage Dependents. So the first question it's going to ask us is, do we need to add a dependent who's not on the electronic form? So trying to think if I could come up with a scenario where this might apply. I'm sure there is. Maybe you've also gotten a paper form for this person and they have a different dependent. But for this case, we're going to go ahead and say no, that we do not have any additional dependents to add, and select Next. So here we have we're showing the spouse, and I see that it's selected not enrolled for medical and dental. So what I'm going to do is select this Edit Dependent, and I'm going to come in here and review that all of this information looks correct based on the form that we received, and add coverage to dependent. So based on our form that was submitted, we did see that the dependent should be enrolled in medical and dental. So I'm going to select medical and dental here. And then they said no to their tobacco attestation. So I'm going to select no, continue here. And my spousal response. Where is my spousal response? Jeff, can you take that note, please, about the spousal response on the form?
I can. Can you hear me?
Yes.
Got it.
Okay. I remember that we selected no for question number 2, so I'm going to go ahead and select that and hit next. And then we're not going to pay the surcharge, so proceed to dental dependent review. And now I see that the spouse is showing as medical and dental enrolled. No surcharges are applying. They do not have Medicare A or B, so I'm going to save and finish. Okay, so now I have no additional dependents. We see that our spouse is showing medical and dental enrolled. And now it's going to say, let's upload eligibility documents. This is not something that you guys would necessarily need to do if you've already received documents through imaging or anything of that nature. You don't necessarily need to be uploading documents, so we can just go ahead and move past this and go into proceed to attestations. I'm going to select next. And then based on the subscriber's response, so now this is for the actual subscriber themselves. Based on the subscriber response, they said no to their tobacco attestation. So I'm going to select no, hit next, proceed through the legal notice, and confirm the tobacco surcharge, not surcharge. And now I have the opportunity to review everything that we have submitted on behalf of the subscriber. So it shows us their coverage effective dates, 3/1 for both subscriber and dependent. It shows us the plan that they selected. It shows us the dental plan they've selected. We're going to go ahead and hit next here. And then these are not eligible coverages because they life insurance that's for employee coverage. So we can just go ahead and hit next here. And then we have the final legal notice and hit confirm. And now this is the final election notice. So those enrollments have now been submitted on behalf of the retiree. So this is like completing, keying all of those various screens in Pay One, and they are now enrolled. Any questions on that process? Okay. All right. So we worked through what it looks like to actually submit a retiree request and then process a retiree request. So it is much the same as a COBRA or unpaid leave request, but I would like to go ahead and take a look at that since it is a little bit different. So I'm going to head back to my dashboard here. And I am going to search for a subscriber who I know has been terminated. So this is somebody I added previously. I'm going to go ahead and terminate them. Active sub employee here. So give me just a minute. Okay. So now for this subscriber who has been terminated, they want to enroll in COBRA coverage. So they would they would log back into benefits 24/7. They would also go to this retiree and continuation coverage page. And because this subscriber has been terminated, they now see two options. And of course, you guys can't see them. They see two options in this drop down: retiree enrollment deferral form or COBRA enrollment or termination form. So previously, for the subscriber customer service who was actively enrolled in PEB coverage, they only saw the retiree enrollment form. But now this individual termed subscriber actually has the ability to see the COBRA form. So I'm going to select the COBRA enrollment form and I'm going to create the request. Again, we have the ability to opt out as HCA staff, but I do not want to do that because I just want to show you guys the form. It should be very, very similar to what we just went through, but let's go ahead and walk through that process. So I'm going to say no. And here it's going to give me information about the COBRA coverage and ask me to proceed to payment information. How do I want to make my payment? Electronic debit or monthly invoice? We'll just go ahead and say monthly invoice here and proceed to enrollment form. And this should look and feel very similar to that retiree form process. Our demographic information and address information is pre-populated already because they've been in the system. I do not have a different mailing address. It asks a question: are you or any eligible dependents enrolled in SEB insurance coverage under another account? And we could say yes or no. And then here's where we select what coverages the subscriber would like to enroll in for their COBRA coverage. So in this case, let's say we only want to continue medical. We can say do not continue for dental and do not continue for vision. We also have the option for terminate coverage. If I was already enrolled, I could come in here and use this same form to submit a request to terminate that coverage. Now we're going to move into some additional questions. Are you covered by another group? Are you covered by another medical, dental, vision? Do you receive Social Security disability? If any one of these options were selected as yes, we would require that effective date. Since they know that effective date is not required. Here we have questions about Medicare, Part A and Part B. We're going to go ahead and select no. We have that option to enter the Medicare number if they are enrolled in Medicare. And then we have the tobacco surcharge question again. So I'm just, for the ease of things, going to say no and proceed to dependents. So this person did not have any dependents enrolled on their account. So you can see that they don't have anybody displayed and they don't have any option to add anybody. They would need to have a qualifying event at this point in time. So it does link them to information on special open enrollments. So we just go ahead and hit continue here. And now it's going to show them the plan options. What would you like to enroll in? We'll go ahead and select UMP high deductible for fun and select continue. We're not going to enroll in dental, so we're going to hit continue. We're not enrolling in vision, so we'll just hit continue. I would select and upload any documents as applicable if I needed to provide dependent verification or any other applicable documents. In this case, I do not, so I'm just going to hit continue. And now I have that ability to download my form and review it before I hit submit. So let's just go ahead and take a look. I close the other one so I don't get confused. And again, this PDF is very similar to the retiree request just want to acknowledge that basically you're seeing the same information here, and this is how we will process that request. All right, so let's go back and I'm going to go ahead and hit submit. And again, we see that's waiting for review. Same options now to edit or delete and download that PDF again. So I'm going to go back to my self-pay dashboard, and I recognize that we're walking through a lot of things that you know, the subscriber themselves does complete, but I wanted to acknowledge the process because you guys are going to be getting these requests and sometimes even getting questions about how do I do this? Where do I find it? And so while it may not be something that you're actively doing every day as part of your daily work, I did want to walk through what that process looks like. So I apologize if it's a little repetitive. So I come back into my request queue again. So in this case, I know the item was not already assigned to me. But here's what I am going to do. So I see term subscriber, and because there are so many of us who have who are working these requests, and this request queue of only 5 is probably not super realistic. It's probably going to be much larger. I want to walk through what it looks like to actually assign an item to yourself. So you see these little check boxes here. If you want to select a certain request to assign to yourself, go ahead and select the checkbox next to the name of the subscriber. And then you see 2 options populate. If we select assign to me and save changes, now you can see that that request is automatically assigned to me. So then if I come back to show items assigned to me, now term subscribers request will automatically be in my queue. Same goes for, I'm going to unselect that option. If I select that request again, I can also then unassign it and save changes. So let's say you were looking at a request and you thought you had everything you needed. Maybe you had to put out a phone call to the subscriber themselves and tell them that they needed more information. Then you could come in here and unassign it and release it back into the queue for working once that additional information has been received. So wanted to walk through what it looks like to assign and unassign. And I know that there's probably more for somebody like Jody who's mass assigning things. There's the ability to assign several different things. So if we look at customer service and term subscriber, we can select 2 at once and also select assign to me and save changes. And then both of those can be assigned to me at one time. So let's go into the,
Amanda,
yes.
I know I'm not the audience, but I'm going to ask a question, which you'll probably get to. But in the account histories, will it show the assigning and the unassigning? Like if Jody's going into track work, would she be able to see I assigned it to this person this day, I unassigned it that day?
I believe that's what we have on the report, correct, Jeff? The report that we created for the QTR report. Jeffrey.
Oh, sorry, I was double muted. Yes, that information will be available.
Perfect, thank you.
You're welcome. All right, so if we're looking at term subscribers, Cobra request here, again, very, very similar to, well, it is exactly the same as the retiree request. So we have the opportunity to deny it if it's not appropriate, approve pending payment, or just straight approved. We know that we don't actually have payment for this individual. And I want to recognize that when we select approved pending payment, the processing status automatically populates as pen for first payment, an approved pending first payment. So this request status, the subscriber themselves will see. So if they were to log back into their benefits 24/7, they would actually be able to see that their request was approved, but they need to submit their payment. And then once we have their payment, we'd want to come back and change this to approved, and processing status would be complete at that point in time. So let's pretend we know that term subscriber has submitted their payment. So I'm going to go ahead and select straight up approved here and submit changes. And again, we now need to go and add that self-pay origin record here for our subscriber. So this time I'm just going to go ahead and select add self-pay subscriber right in this little link here. It brings me to this screen and I add self-pay subscriber. I enter that social security number and agency effective date based on their request. Why is it not showing the date? That's a problem. We document that, please, for the date submitted on the request.
I will. Can you hear me?
Yes.
If it matters, if you go back to the benefits 24/7 screen for a second on that request. Oh, sorry, because you're adding the agency effective date here. I get it. Okay.
Yep.
When you're on the request itself, we show when the coverage ended.
Right.
Yeah, I gotcha. Cool. Thanks.
Thank you. Luckily, I remember that I termed them 2/28, so their request is going to be effective 3/1 in this case. Previous subscriber record found. We're going to go ahead and claim that. And then again, we see that same page here for adding them to coverage. So this is a SEB. I'm going to take a real guess here. SEB Cobra, right? Yes. Okay. 107 TK. For some reason, that one's burned in my brain. I'm going to select eligibility type. The options here are Cobra dental only, Cobra medical dental vision, or Cobra vision only. I'm going to select Cobra medical dental vision. My eligibility reason, again, I'm going to select 01. We have the same 4 eligibility reasons that we talked about earlier, 01, 12, 04, and 05. And then my original agency, sub-agency, I cannot remember what Vancouver is. I'm going to take a wild guess though. They are, oh, I know what they are. Okay, select my original agency,
Ooh.
sub-agency.
Impressive,
CT5.
Amanda.
Well, 3.5 years of sub information stored in my brain. All right, pay method. We have bank account withdrawal, personal check. And so I'm going to select personal check. I know that was what was on our form. Cobra qualify reason. We have dependent loss coverage. No longer a full-time student, 36 months. Employee is deceased, so the spouse and or children has 36 months. Employee terminated from the agency. And then we have an ex-spouse. So those are the 4 options in the Cobra qualify reason drop down here. So I'm going to select employee terminated from agency. Cobra self-pay end date. If they have 18 months, that would be, I think that's close to right. So we would enter that self-pay end date based on that 18 months. Election period end date. Oh goodness. I'm gonna say this is probably wrong, so just hang with me. We'll put that election period end date. You guys are much more familiar with what those dates are than I am. And then we have that originating SSN. agency effective start date based on what we input on the add self-pay subscriber screen, update any other additional applicable information. We do not have an additional address, so now I'm going to hit submit. Okay, I've successfully added that subscriber now. Now I can go back to my request here and unselect items for me, unselect pending, and I'm going to go to my, I want to acknowledge here too, actually, before I move too fast. So in any of these, I would consider this a grid, right? Or a queue here where there's several different columns. This little, to me, it looks like a light bulb, a can light bulb, but it's technically a filter. Every column has the ability to do a filter. So if you wanted to filter by any one of these things, let's say something as simple as it has documents or not. If you select this filter option and you select is true and filter, it's going to show you only requests that have a document attached to it. If I clear that filter, it goes back to showing me everything. So I could come in here because again, once this, once we're actually live and we have the requests coming in, we recognize that this queue is going to get rather large. So you can come and select this subscriber filter option and we can look for, you know, whomever we're searching for contains, and you can enter first or last name and hit filter. And there is my person that I'm coming in to manage. So then I only can see, I can kind of filter through that queue so it's not so large. I don't have to go page by page looking for somebody. So I'm going to go ahead and select that request. Oh, I didn't. I meant expand the request. And then I can scroll down. And again, now I can process those changes. Go ahead and select this. My coverage effective date's already pre-populated here. Go ahead and hit next. I don't understand why this is happening. We will make sure that silly bug is fixed. Okay, come back into my request here, and I'm going to move through this quickly because this is really more or less the same as processing a retiree request, which we just did. It's going to walk us through the coverages first. And so I'm going to go ahead and select, what did they select here? UMP high deductible. So I'll go ahead and select that. Medical plan. We're not continuing dental, so I'm going to go ahead and select the do not continue box. We know that they're not selecting vision, so do not continue. Here we get that plan notification and plan confirmation message, and then review any information here. Hit next. Going to ask us there if there's any dependents. We know this person did not have dependents, so we're going to proceed to their attestations based on their form. Am I going too fast? I don't see the attestation on this. Okay. It's another fun thing. If one of you guys will take a note on that, that the tobacco attestation is missing from the COBRA form. All right, go ahead and confirm. And I also thought, Jeff, the Supplemental coverages screen is still showing. I thought we had that bug resolved, but we need to remove that from the Cobra wizard here. So ignore that page because it won't be there. Here is the summary of coverage elections. It shows us that the subscriber themselves is enrolled in medical and what their effective date is. They're not going to be enrolled in dental and vision per their request. We can go ahead and select next. We review the legal notices and hit confirm, and now their enrollment is complete. So we have now looked at both submitting and processing a retiree and COBRA request. We've also talked about assigning work items to ourselves, unassigning a work item. I know that's been a lot so far. Do we have questions? Is this a lot of information? Okay, let's go into, I'm going to go back to my self-pay dashboard here, and let's look at how we might update some information on a subscriber. So let's say we got a phone call from a subscriber and we needed to, I'm gonna pull up my subscriber here. So Mr. Subscriber or Mrs. Subscriber, I can't remember their gender, gave us a phone call and we know that they had a little bit of incorrect information in their demographics. So we could come into the manage self-pay subscribers, we search for that individual, we select the checkbox and we manage the subscriber. So then we get to their subscriber dashboard. And if we need to make an update to their demographic information, for example, we want to select this eligibility tab up here. So once we are in the managing a subscriber, we have the tiles that are on their dashboard if they were to log into benefits 24/7. But we also have some additional options as an HCA staff member to when we're managing their account. So eligibility is one of them, because this is where all of their demographic information lies. This is where their self-pay eligibility information lies. If we need to terminate somebody, we would come into their eligibility tab and complete the termination, which we will do next week in our second session. We will look at terminations. What about if we needed to add Medicare information? We could come in and update or add Medicare information through their eligibility page. And contact information. This is actually one set of information that the subscriber themselves can update their email or phone numbers. They have the ability to do this themselves. But what if we got, and there's also residential and mailing address as well. But what if we got a phone call and they said, you know, I have a very popular name and I want to make sure that you recognize what my middle name is and my suffix. Let's say I am a junior. So we could come in here and say that, you know, we got that information from them, update their middle name, update their suffix, any kind of updates to demographics. Maybe we have a social security number that's slightly off. I know those things do happen. So at any point, if we need to update information, we come into that eligibility tab. We can make the applicable updates to that information. And then we scroll to the bottom of the page and we just hit submit. So that is how we would make a change to any of their demographics. Pretty simple and straightforward, but did want to make sure that we talked about doing that.
Hey, Amanda, real quick, did you
Yes.
say that they can change their address as well on here along with their email and phone number?
A great question. I did not say that they could change their address here, but we can talk about that. So one of the things that we discussed with several folks is the ability to submit an address change request, because we recognize that many times our self-pay members will call, or they'll submit or they'll fax in a document that says that they have an address request. And so how we did that within Benefits 24/7, the subscriber, when they come to their dashboard here, we have this section, special open enrollment and account changes. And I do want to touch on special open enrollments next week in our next session, but we can look at how to submit an address change. So if we come to this special SOE and account changes page or tile, and we select this, it's going to provide us some information, and this is a bug that we have that needs to be fixed, so it's not going to let me show for some reason. So this page allows, if the subscriber was to submit, let's just say 2 months down the road, they have a special open enrollment event, they could come in here and select the form. And like I said, we will go through that next week. They also have the ability to submit an address change request. And I can't show you that today, so I'm also going to have to show you that next week. But we do have the ability for them to come in through the account changes and SOE page, and they can submit a request to change their address. Basically going to give them that same address, fields, and opportunity to just update those fields and submit it. And then you guys will get that request and be able to go through and process those. So they do have the ability to do that within Benefits 24/7. I'm really
Thank
sorry
you.
that this is, not working today. Let me make that note. Okay. All right. Sorry, I was making that note. Okay. The other thing that I know we are all very used to doing, because I see many of your wonderful notes in Pay One, is when we do make changes to an account or receive a phone call from a subscriber and provide them information, we want to make a note on their account so that if somebody else comes along the next day or next week and also has a conversation with that member, we keep those records and we can refer back to that. So in order to make a note on their account in Benefits 24/7, again, we go to that individual, we manage that subscriber, and then here in these tabs, we have the notes section. So if we select the notes, we now have the ability to add a note onto their account. So one thing I will say is that all of the wonderful notes that have been made on the 58 screens in Pay One are not going to be added into Benefits 24/7. So anything that's already been notated in Pay One up until the point that Benefits 24/7 goes live in May, those notes will remain in Pay One. Anything going forward where we talk to a subscriber or all of the various things that we would make notes for, we'd want to do them on this screen. So we can come in here to their subscriber and we go to the notes page. We select add a note. It gives us a free form box here and we can just say, you guys have really nice shorthand for talking to subscribers, but per phone call with subscriber sent retiree packet. I'm just making up something. So I type in my note and now I can hit submit. And then once we've submitted that note, it shows us when it was created, who created the note, and what the note is. And I see, Christina, you put in a question about will we still have access to Pay One to see previous notes? And the answer to that is yes. There will still be the ability to see previous notes in Pay One. So you'll be able to refer to those records.
Amanda, will
Yes.
these notes also then transfer over to Pay One?
They will not. So I know that
Oh.
yes. So for accounting type of things, I think we probably need to have a workflow conversation. I probably want to touch base a little bit more with Alexi's group on what that needs to look like. You know, maybe we just need to have the copy paste into both systems, because I do recognize that notes need to be done for accounting purposes as well. So I will make sure that we have that conversation.
Thank you.
Yeah, no problem.
Are these notes going to be modifiable, or is it going to be just like Pay One and they're there?
They're there.
Cool.
Yeah.
And
Cool.
then
Good question.
I have another question, and this is just based off of what you just said about possibly doing like a copy and paste note wise from the system to Pay One. With Pay One, you have to put the note in like a certain way. You can't just copy and paste something in it. Otherwise, like it doesn't all show up properly. So if that is the case, could it be made so that way it is copy and pasteable, where like actual Pay One will take how it's pasted into it, so we don't have to like retype it on that side of the system?
We're gonna we'll figure a solution out for this. So I don't think that we need to worry about that right now, because we'll definitely work to come up with a different solution than that. Sorry for jumping in.
No, I appreciate it.
Yeah.
Thank you. Yeah, I agree. I'd like to have that conversation as well. So thank you, Alexi. I appreciate it. All right. So I'm looking at our time and I'm looking at my list on what else we can talk about. And so I do want to touch base on one other thing here. So we do have some. Okay. So on the self-pay dashboard, we also have the dependent verification. And so this is really going to be applicable when we have new dependents who are added. Maybe there's a special open enrollment where they have added a new dependent. If we have dependents that need to be verified, we will see this 0 verification request. It will actually have a number here. And so if we get a request, a special open enrollment request, let's say somebody's on COBRA coverage and they have a newborn, and they've submitted their special open enrollment request to add that baby to coverage. They also then have to provide that documentation to verify their dependent. So we would see that we have that request. We would also see that dependent verification populate in the verification queue here. So we would, once we get through processing that request, we'd also come into the dependent verification queue and we would search for that subscriber and the applicable dependent. And we would open that, we would expand that dependent subscriber record, and we'd want to complete the verification. So here you can actually see, this is my spouse that was part of customer service. They were already verified because they were verified as part of the PEB coverage. But let's just pretend this was the newborn baby and we had provided documentation. I'm actually going to open Laura's here so you guys can see this. If there is a document attached to that dependent, you'll see it here in the verification documents. We have that picture of a mountain and a sun here that is selectable to view. If we would be able to see that document display here. I think we have a already documented bug of this happening, so that will be fixed. So we can review that document, and if they are in fact an applicable dependent and all of the information is correct, we would come in here, we could select to verify, and we have a verification statuses. We have verified, verified exempt, verified extended dependent, verified non-Washington registration, verified Washington registration. If we just select verify, they are a verified newborn in this case. Their birth certificate was allowable, and we would, this again is going to auto populate to the date in which you're reviewing the request. This was done a couple of days ago by Laura. We can change that date if we need to, if it was done a few days ago, but typically you're going to be doing it on the day that you're completing the request, so you just leave that date. And then we can select the allowable document type. So what's showing on my screen that you guys can't see in this case of a spouse, we have the allowable documentation, a DEERS registration, a J1 or J2 visa, legal separation notice, a marriage certificate, a petition for dissolution, and tax return. In the case of a newborn, we'd see a birth certificate, a tax return, which isn't always applicable for a newborn, but any of the allowable document types for a child. And then once you've submitted that document type, you just hit submit changes. And so that's how you would complete dependent verification when you are processing a request for adding a dependent. Does that make sense? Any questions about processing a dependent verification? Right. Let's see here. Updating a tobacco attestation. Why don't we look at that? So typically this is something that our subscribers are going to be doing themselves, but let's look at how we can actually, how subscribers can do that in case we get a question from somebody. So we're going to look at the subscriber dashboard here. And again, this is what actually looks like, the dashboard actually looks like for the subscribers themselves. So when they log into their dashboard, they see this tobacco attestations page. And if they select this tile at any point in time, and recognizing that this is not this, we have a bug on this. Obviously we can't see the yes or no buttons here. This will be fixed, I promise. We need to get an update into our training environment here. But if the subscriber needed to come in and make a change to their tobacco attestation or dependent's tobacco attestation, all of the subscriber and dependents would be listed on this page. And they would have the opportunity to change from yes to a no in the case that they stopped using tobacco, or they could change from a no to a yes if they started using tobacco. So this is where they would go to do that tobacco attestation. And of course, if we needed to help a subscriber on their behalf, we would come into their tobacco surcharge page, and we could make that change. And of course, I recognize that this page looks all sorts of funky right now. So this is where we would go to make a change to the tobacco attestation. Let's see. Keep referring to my list to make sure I stay on track here. So I actually think based on what I have on my list, I think this might be a good place to kind of put a pin in things for today. I do know that we have another session scheduled for next week. And so we will talk more next week about adding subscribers who are not in the system at all, which is going to look very familiar to things that we did today. We're going to look at some subscriber history, so being able to see a history of changes that were made on an account. We're going to look at how to terminate coverage and those SOE and account changes that can be done in Benefits 24/7. So any questions that we can answer today before we wrap up? Any comments? All right. Well, I will stick around. If anybody wants to ask questions in a smaller capacity, I'm happy to do so. And for everybody else, have a wonderful day and look forward to our next session next week. Take care, everybody. Thank you.
Thank you.
Thanks, Amanda.
Good job.
Thank you.